That's a good crowd.
Yeah.
I wish I was there. I'm here in like Radio Free California, I guess.
All right. Okay, so say it right
So
here.
I'm just going to say, I happened to have the opportunity to interact with the Surgeon General on a flight, and I happened to have the Harvard Pilgrim study in my satchel that I was able to hand to him personally and have like a 20 to 30 minute dialogue with him. Now, he looked at that and obviously had never seen it in his life. He blanked out. And my question is this. Having already interacted with Ron Wyden, the Surgeon General, and other people like that, only to get blank stares, who is best to present this kind of information to, in your opinion?
This is really, you know, Paula, I feel for you, and I've seen those blank stares, and they have absolutely nothing to say back. A lot of them are bought and sold by pharma, and that's really, really too bad. But you know, one of the things that I think we're going to have to do is lead this battle in the States. And you know, the person that I was most encouraged by and most surprised by was Jamal Hawley in New Jersey, because he's a Democrat, and a lot of times Democrats find themselves on the opposite side of this issue as us, and yet he got it and he understood. He understood the CDC whistleblower. He understood, you know, many different issues that were presented to him. So, you know, I really think that the fights have to be at the grassroots, at the state level. This is where, you know, depending on the administration, this is where we're going to be fighting mandates for COVID-19 vaccines. And so, you know, if you can do that at the state level, at your state capital, you know, I live 2.5 hours from Sacramento, so I have no excuse to be down at Sacramento, meeting with my legislators, meeting with other legislators who, you know, with whom I can bring their constituents. To do that, I've found that I've gotten much more traction at the state level, even in California, and also, you know, going from different, you know, going from state to state, that there's, you know, much more traction there, and there's less of that sort of fluoride stare that you get from a Surgeon General, or from a Ron Wyden, or from a Gavin Newsom, or, you know, et cetera, et cetera, et cetera. So, you know, that's where I would focus the battle. I think that's where the battle is going to be. I wish that I never got that stare again in my entire life.
Yeah. Okay, do we have any other questions? Kristen, do you want to come up here and sit? Be careful coming up here because all the wires are on this side and all the questions are on. Here, come around this way. Reduce our liability. Okay, go ahead.
Hi, Brian.
Hi, Susan.
Kristen.
It's another Kristen.
Kristen.
Another
sorry.
Kristen.
The other Kristen.
Yes, I have vaccinated children, so thank you for fighting this fight on behalf of all of us. I appreciate you. My question, Brian, is that listening to your statistics in your study is, it seems like in some of the cohorts, especially the 0 to 12 months, is maybe they only had one vaccine. And from my small experience in my little family group, is that my children that were vaccinated the day they were born with, say, hepatitis B, were highly injured or more injured than my kids who waited 2 or 3 months to be vaccinated with hepatitis B. And so the severity of long-term damage was more severe if they were vaccinated earlier than if they were vaccinated later. And so when you have a cohort where there's only one vaccine from 0 to 12 months, does that skew the results if you see a kid with one vaccine versus multiple vaccines and later versus earlier? I would think that would really change the data. Is that too much?
You hit the nail on the head. You're absolutely correct. If you look at the average age of the first vaccination received in this particular cohort, it was 102 days. So that's after 3 months of age. And so these were under-vaccinated. If you consider the full CDC vaccination schedule, that's 21 vaccines by year 1 and vaccine on hepatitis B on day 1. So these kids were under-vaccinated. So what I would say is that this biases towards not finding an association, and the odds ratios that I reported are probably, if we had fully vaccinated children, would be much, much higher. And so it is, it becomes incumbent to find more data, in the pediatric practices that that participated in this particular study. They were friendly to non-vaccinating patients, and so therefore I got a lot of unvaccinated children in that particular cohort. The drawback is we don't know what those odds ratios are when we're looking at children who are vaccinated on day 1 and children that are getting fully 21 needle sticks. This is a skewed sample, as you're saying, and I think that if we had a fully vaccinated cohort to compare to a fully unvaccinated cohort, we would only see those relationships strengthen.
Thank you, Brian.
So Heather had a question, and then we'll see how long that one takes and how much time we have left, okay? We're getting pretty close right now.
Hi, my name's Heather. I don't know if my question or my comment goes back from that, though, is you have to look at pregnancy because they're giving the flu shot and Tdap in pregnancy, and that's causing miscarriages, stillbirths, and a lot of complications that way. And so you can't just do it from birth. You have to go back to the mother because there's so much that crosses the placenta and can cause, neonatal mortality as well. So just making that comment about it, because I mean that's just a whole different factor in there as well.
And Heather knows this stuff, so you'll find out later in the program how much she knows. Heather is actually a midwife and a registered nurse, so she's asking from experience. Do you have anything to say to that?
You guys are such an educated group, based on the questions that I'm hearing so far. It was very, very difficult to get maternal records in this particular instance, and that's why I want to crack open things like the vaccine safety data, like at the CDC. We're spending $30 million of taxpayer money maintaining that database for the CDC, and no independent researchers can see it. It's impossible for independent researchers to see it. So it's high time that we crack that thing open. That's one of my projects, is cracking the vaccine safety data like open, because you can get that maternal record, you can get maternal information, and those studies that the CDC did, where they looked at maternal thimerosal exposure, they did see a relationship between regressive autism spectrum disorder and the amount of mercury that was given during pregnancy through the flu shot. It's varied statistic. They did, smoke and mirrors like they usually do to not report the statistics, but it was a significant relationship, and that only accounted for prenatal thimerosal concentration. It didn't account for the Tdap, which contains aluminum, and it didn't account for the rest of the vaccination schedule after the children were born. So we need this information.
Okay, one more question. We're just going to have one more question, Brian, okay?
Okay, sounds great.
I was wondering, I know this study was done from 1 year, from 0 to 1 year plus maybe 15 days. I have a lot of friends who notice the problems in their children with autism at the age of 18 months. Are you planning on doing a study from maybe that second year of life?
Yes. When you have the diagnoses of ear infections that happen earlier, then we have to cut off, we want to have a temporal relationship. So vaccines were first, and then the diagnosis came later. So we didn't get wrapped around the axle having a diagnosis before the child was even vaccinated. But when we look at developmental delays, when we look at autism, when we look at speech and language delay, when we look at ADD, ADHD, then we need to make sure that we're looking at those, older children, because children, like my own child, his worst vaccine injury came when he was 15 months old. So he would, his entry would have not been included in this particular study the way that it was set up. We are planning follow-up studies. In fact, I was sitting there listening to myself drone on in my presentation, and I'm working on a study that we're just getting ready to submit for peer review, Neil Miller and I. So there are follow-on studies, and those are in the works. We want to focus on neurodevelopmental disorders, and when we do that, we're going to look at later vaccines as well.
Thank you. Thank you, Brian Hooker, for joining us from California. Thank you so much. Next time, you've got to come in person, okay?
I'm sorry?
Be here in person next time.
I will be there. I will be out of the iron curtain that I need right now.
Okay. We'll hope for the best. Thank you.
Okay.